What challenges arise when diagnosing mental health conditions in people living with liver disease?
Mental health conditions, including depression and anxiety, are up to 3 times more common in people with liver disease compared to the general population, and the prevalence is rising. Such conditions reduce health-related quality of life and have an adverse impact on clinical outcome and increase mortality. Common symptoms of depression include anhedonia, low mood, excessive fatigue, and cognitive impairment, with symptoms of anxiety including worrying, irritability, and difficulty concentrating. Some symptoms of liver disease, such as severe fatigue, and those of hepatic encephalopathy, such as difficulty with concentration and decision-making, cognitive impairment, and psychomotor retardation, overlap with mental illness symptoms, making it difficult to distinguish between the conditions. Misdiagnosis can lead to delays in treatment. It is also important to assess whether symptoms are induced by substances, either as part of current medication regimen or through recreational drug use. Mental health conditions are diagnosed using the DSM-5 criteria, which relies on identifying a number of key symptoms via structured clinical interview. This is an objective psychiatric assessment, which requires training and takes time. Such challenges may delay the diagnosis and treatment of mental health conditions in people with liver disease. Screening questionnaires, such as the Hospital Anxiety and Depression Scale, developed to screen for anxiety and depression in patients with physical ill health and well validated in liver disease, are therefore useful to detect and assess severity of coexistent mental illness.
How does the severity of liver disease impact mental and psychological health?
The severity of liver disease significantly impacts mental health, with more severe disease increasing the risk of depressive and anxiety symptoms. People living with liver disease sadly also experience stigma, which further impacts mental health. The progression from compensated to decompensated cirrhosis and development of physical symptoms impacts on the psychological well-being of patients. Symptoms such as abdominal distension and discomfort due to ascites development, jaundice, pruritus, change in body image, irregular sleep patterns, difficulty concentrating, sexual dysfunction, muscle cramps and fatigue have a marked impact on quality of life and mental state. Studies have shown that the development of hepatic encephalopathy and its increasing severity in particular are associated with the development of coexistent depression. In addition, increasing immobility, falls, need for frequent invasive procedures such as paracentesis, dietary restrictions, and increase in medication burden further impact mental health. Patients with chronic physical ill health can also become demoralised. Patients on the liver transplant waiting list are also under an immense psychological burden due to the inherent uncertainty of their situation.
What barriers do physicians face in supporting their liver patients with mental health disorders?
Whilst patients with liver disease often present with untreated mental health disorders, hepatology clinicians may find addressing such conditions challenging, and access to mental health services can be limited. Treatment interventions for anxiety and depression are numerous, and include patient education, self-help measures, psychotherapy, and pharmacological treatment, namely antidepressants. However, there have been no prospective therapeutic trials for the use of such pharmacological agents in the treatment of patients with cirrhosis. Due to the liver's role in the pharmacokinetics of drugs, consideration must be given to choice of agent and dose adjustment, which can cause significant clinician apprehension and may explain the underprescription in this setting. Psychotherapy can be used as a standalone therapy or concomitantly with pharmacotherapy. However, depending on the healthcare setting, access may be scarce. Patients also need to be able to engage in treatment, to learn and retain information, and therefore talking therapies are of limited use in patients with severe physical symptoms and in those with persistent hepatic encephalopathy. Stigma towards both liver disease and mental illness can also present as a barrier to treatment.
How can these interrelated challenges be addressed at the policy level?
Policy-level interventions in mental health focus on creating a supportive environment, removing barriers to access and treatment, and reducing stigma. Preventative public mental health initiatives need to address social determinants of health, addressing social inequalities, and also need to ensure that such interventions reach those at high risk of mental health disorders and poor mental well-being, such as patients with liver disease. Adequate funding for mental health services is required, including in primary care, secondary care, and in community support programs. Access to care needs to be improved by introducing policies to reduce barriers due to geography, affordability, and stigma. The high prevalence and complexity of depressive and anxiety symptoms in patients with liver disease and cirrhosis calls for an integrated care approach, in which mental health and medical care are provided simultaneously, with integration of mental health services into the liver clinic. Education on screening for mental health disorders and appropriate treatment strategies within liver clinics is also required, with the development of formal guidelines. Stigma reduction through public awareness campaigns for both liver disease and mental illness, examples of which include the British Liver Trust Stamp Out Stigma campaign and the UK Time to Change campaign, are also needed to improve mental well-being and reduce delays in seeking help and treatment.